Nursing NCLEX RN Review Video, Strategies for Test Taking on the NCLEX Exam. In this video, I'm going to talk about a few test-taking strategies that enable you to have a systematic approach to answering very common types of questions on the NCLEX exam. Visit my website, www.simplefitnurse.com, for more NCLEX content review and a free ebook where I shared my study schedule for passing the NCLEX exam. The NCLEX has various testing patterns which require different strategies for answering them. In this section, I hope to share with you strategies on identifying these question types and how to best answer them. Once you identify these patterns and trends, you're able to better answer questions and ultimately pass. These strategies work almost every single time, and you will improve your test-taking skills by continuously doing practice questions with these concepts in mind. Before I begin, I want to mention that in my previous videos, I talked about how the exam is going to get more and more difficult over time due to the inherent structure of the exam. As a result, it is important to remember that when you're writing the exam, you will constantly feel like you're not doing well, and this is quite scary. However, now that you know that this exam is designed in a way that constantly challenges you, causing you to think that you're doing horribly or failing, you know to control your emotions and focus on trying your best in answering each question. I want you to just remember that this exam was designed to continuously challenge you, and this often causes a feeling that people are failing or doing poorly because they aren't confident in their answers. This gets to people's heads and makes them panic and deviate from the strategies that I'm about to discuss. Okay, so now that I've mentioned this, let's move on to talking about the nursing process. I'm sure you're familiar with the nursing process at this point. You have to remember the acronym ADPIE and always ask yourself, is the question asking me to recall ADPIE? The best way to know if it is by looking at the key terms from the question itself or the answers. For example, the exam will frame ADPIE questions by usually asking, if this happens, what should the nurse do first? Or what is the first thing the nurse should do? So what is ADPIE? ADPIE stands for Assessment, Diagnosis, Plan, Implementation, and Evaluation. I recommend looking at a list of common nursing diagnoses to get a hang of what exactly they are. Here are a few examples, and if you'd like more, there's a link in the description to my blog post with a list of them. Risk for urinary tract infection related to etiology-related factor as evidenced by certain signs and symptoms. Risk for impaired skin integrity related to as evidenced by ineffective airway clearance related to and as evidenced by. Sometimes the exam will be tricky and give you the nursing diagnoses, and there will be questions that ask about what the next step will be, but they'll put the assessment in one of the options to choose from. In that case, you have to recall that ADPIE acronym and remember that the next step is plan, not assessment, if that makes sense. They want to know that you follow these steps chronologically. This is important as they do try to trick you by doing this. So make sure you identify which part of ADPIE you are in and see if the answers relate to the ADPIE. Before I go on to speaking about strategies for prioritization questions, I would appreciate it if you would rate this video. These videos take a long time to make, and if you would like to see more videos like this, please give me feedback by either giving it a thumbs up or a thumbs down. This will help me decide whether I should make videos like this or not. Thank you. Prioritization questions. You will get a priority question on your NCLEX exam. It is imperative that you have a strategy that you utilize when answering these types of questions. There are two concepts that are important for you to remember for answering these questions. Number 1 is Maslow's hierarchy of needs, and number 2 is the primary assessment survey. Think of Maslow's hierarchy of needs as a pyramid in which the most important needs are at the base of the pyramid and need to be met before moving to the next category of needs can be achieved. For example, basic needs of food, water, warmth, rest, and safety need to be met before the safety needs are completely met. This picture is a great summary of what Maslow's hierarchies of needs are, starting from bottom to top in relation to most important to least important. If you want to be successful at priority questions, you need to recall this diagram in your head and utilize it systematically to systematically remove answers from the questions you're answering. Secondly, using the primary assessment survey is a way of ensuring the safety and stability of a patient's condition. It is an initial assessment that needs to be done when seeing a patient, and there are certain assessments that are prioritized than others. Airway, breathing, circulation. This is key for you to remember, the ABCs. This will guide you in choosing the correct answer. If there are answers where it talks about an airway being obstructed, then you need to focus on opening the airway. Common assessments indicating problems in ABCs are NPO, gag reflex, breathing water after surgery, dysphagia after stroke. For breathing, breath sounds, O2 administration, O2 status, pulse ox, raising the head of the bed, spirometry. For circulation, heart rate, blood pressure, CPR, fluid status, fluid deficient or overloaded, IV fluids, TPN, central lines, bleeding hemorrhage. The only exception to this is if they have uncontrolled bleeding that takes priority over anything, and typically you want to control the bleeding, whether that is putting pressure or tying a tourniquet. Provider questions. A common question type on the NCLEX exam are provider questions. These are going to test your ability to communicate to the provider. To answer these questions, you need to think of life-threatening conditions and situation, whether those lab values or clinical presentations indicate severe complications that need to be reported to the healthcare provider or not. Unfortunately, these are among the most challenging questions as they often require a high amount of memorization on generally everything. This is where they test your ability to remember lab values and a few life-threatening conditions. This is the strategy I use to answer these types of questions apart from memorizing common lab values. Also, be sure to subscribe for my lab values NCLEX video. So when I go into these types of questions, the first question I ask myself is, number 1, does the patient have any of these life-threatening conditions using the head-to-toe method? So neurology, do they have a stroke, overdose, or drug interaction? Think of mental health drugs. Throat, do they have esophageal varices? Respiratory, do they have a tension pneumothorax? Are they having an asthma exacerbation, pleural effusion? Cardiac, abdominal aortic aneurysm, myocardial infarction, cardiac tamponade. GI, profusely bleeding, do they have a profusely bleeding GI bleed? Perforated organs such as the appendix, pancreas, spleen. Metabolic such as diabetes, DKA, HHNKS, hypoglycemia. Impact injury, do they have spine injury? Do they have a loss of rectal tone? Pregnancy, do they have an ectopic pregnancy? Are they hemorrhaging? And number 2, I ask myself, is there anything I need to do before informing the provider? Think of the acronym ADPIE. That will guide you on that. This has helped me organize my thoughts in a systematic way and tackle these provider questions more effectively. Let's move on to talking about the dreaded SATA or select all that apply questions. SATA or select all that apply. These questions are the most challenging questions on the NCLEX. They require a serious amount of knowledge, and unfortunately, the better you do on the NCLEX, the more these questions are they're going to give to you. Therefore, having a strategy to utilize can help you guide you on how to answer each question. There is no trick that will get you results. These require you to know a lot, but I will say that there are a few tips I can share which can help answer these questions. Number one, go through each answer and ask yourself if it is a true statement. Use the process of elimination to determine if that answer can be correct. If any part of the answer makes it false, then cross it off. Number two, compare the answer options with each other. If there are very strong opinions such as always, never, none, you want to avoid these. These can be correct, but they rarely are. As mentioned, there aren't great strategies other than doing tons of practice questions that are going to help you with those. Now let's move on to prefixes and suffixes. These are incredibly helpful for you to know when answering questions, as there are certain conditions that you may not remember. However, knowing the prefix and suffix can help you get an idea of what the condition / the situation of the patient is. Here's a video I made to provide better guidance on what to do. Duplicating statements. Duplicating statements are huge hints on the exam. They're actually more common than what you might think. If the answers have two that mean the same thing, they can't be correct. You'll get some questions that have the same meaning but are worded a bit differently. If it is a single choice question and answer, then it can't be correct. So that's going to be the end of this video. Be sure to check out the links in the description for various resources, and check out my blog at www.simplefitnurse.com, where I have various free content to help make nursing simple for you. Here's a preview of how to get to my website. Hey guys, just thought I would show you how to get to my website. All you got to do is go to Google and search Simple Fit Nurse, or you can go to your web browser and search www.simplefitnurse.com. In my website, I have free ebooks that I've created. I have a free fitness guide, I have a free NCLEX guide, and I have a free nutrition guide that I've created, and it's all free. You can click on the appropriate tabs at the top of my website and you get access to them. I do post blog posts every single week with my videos, and they're helpful if you want to take a look at graphs and diagrams that come along with that. I also have a NCLEX review session where I post all my NCLEX content, so be sure to check those out. Also, if you're interested, check out these videos and be sure to subscribe for more content every single week. Thank you for watching, and thank you for making it till the very, very end. I appreciate it. See you next time.